Good afternoon, everyone. My name is Anna, and today we will be discussing referrals for endodontic treatment, when a referral is indicated, and how to make an effective and appropriate referral. So, a couple of things about myself. I come from Greece. From a small city called Kavala, which is in the northeast part of Greece. We are quite lucky there, and we enjoy the coastal views. You can see some pictures and videos over here. Quite peaceful lifestyle, I would say, but too quiet for me. So after that, I started my journey. So I moved to Saloniki, where I completed my undergraduate degrees in Aristotle University in 2016. So then I moved to Bristol in the UK when I started working as a general practitioner, and then London. I wanted to explore the big city, and I was always keen in endodontics. And I realized that endo is a part of a big family of restorative discipline. So I said, okay, let's study a little bit further. And I did my postgraduate diploma in restorative dentistry in University of Birmingham. At the same time, everyone started talking about CBCT. And at that point, I didn't know much about that because in 2000, after 2016 in Greece, we didn't take many CBCTs. So as I got fascinated, and when something intrigues me, I need to fully immerse myself to a program. So I did my PG certificate in dental radiology and CBCT in King's College London. And then the major milestone of my journey, which is the Eastman Dental Hospital and UCL. I'm about to complete my MCLIT studies next September. You will find me in this university during the week, and on Wednesdays I work in Optimal Dental Clinic. You might ask why I like endo. Well, it's because of this. You can see the videos on the screen. This beautiful natural anatomy. These are videos taken from the Root Canal Anatomy project. So these are the areas that we need to clean, to disinfect, and obturate in 3 dimensions. It's not just gray-black lines that we see in the 2-dimensional radiographs. It's much more complicated than that. We have isthmuses, we have anastomoses, lateral canals, and we need to be aware of this anatomy. We need to locate it, and we need to respect it as well. Back when I was in Greece, when I was in the undergraduate program, one of my professors told me that good dentist doesn't need tools. Now I completely disagree with this statement, to be honest. I think in modern dentistry we need tools. We need tools to get in these areas. And I cannot work with these tools. And these are, well, our gadgets. We need magnification, we need good light, we need the CBCT to appreciate the anatomy in 3 dimensions, and ultrasonics. Use ultrasonics throughout the endodontic treatment. You will see our setup. This is a normal setup we have when we have endodontic treatment at Optimal Dental Clinic. And why we need CBCT? Well, CBCT helps us with diagnosis. We know that from 2-dimensional images we cannot see everything. We have anatomical noise, we have geometric distortion, so we might need to remove all that and to see the third dimension. And this will help us with diagnosis sometimes. And also this will lead to accurate treatment planning. We can change our treatment plan after we report on a CBCT. This will help us to avoid any over treatments, and we can it will help us through the consent process with the patient. And also, if we have a preoperative CBCT, we might want to review our cases more accurately with a scan as well. So this is a case we had quite recently here at practice, to treat or not to treat. So this case was referred to us. The referrer was saying, please as further assess and manage the lower right 4 and lower right 6. So basically, from the two-dimensional images, we can see periapical radiolucency on the 4 and the 6 as well. The lower right 4 was had a previous restoration that failed, and basically there was direct access on the root canal that was completely necrotic. When I saw the case, the patient, the lower right 6 was responding to cold. The patient was completely asymptomatic, by the way, so we needed a scan to initiate the treatment of the 4 because I could see the deep bifurcation, 2 canals for sure. So I needed a scan, and here we are. We can see mixed density lesions in the whole mandible, part of the mandible that is included in the scan. So these lesions are textbook image of florid cematosis dysplasia, basically. So after we saw that and we went a little bit further back, we noticed that the patient is at her 50s, Afro-Caribbean in origin. So everything was matching our diagnosis, and we're quite confident that this tooth didn't need treatment, didn't need endodontic treatment. So basically, we completed the treatment on the lower right 4, and we didn't treat the lower right 6. We said, let's monitor. Most likely, this lesion is from cematosis dysplasia. However, if symptoms arise, please contact us to investigate further. So our workflow, when we see a patient for the first time, we want to do our full mouth examination, like to do quickly full mouth examination, plus or minus a scan. And then we explain everything to the patient, of course. We like to send a letter to the patient and to the referring dentist regarding our findings and the treatment plan that we propose regarding the tooth in question. Then restorability assessment. I like to do my own composite build-ups, press core, and then we can make sure that the tooth can be predictably restored, and we can proceed with endodontic treatment. Of course, when the case is finished, it will have a nice coronal seal with direct composite overlay, depending on the case as well. And the letter will be sent to the referring dentist and to the patient as well, and we will agree on the review. Basically, regarding the review, I like to follow up my own cases. So we tend to give a call to the patient to pass by so we can do our examination and to take a new periapical radiograph. However, if this is not convenient to the patient, we are happy that you take the radiographs and you can forward everything to us. Here at Optimal Dental, we follow a holistic approach. Everything derives from Greece, of course. So holistic means derives from the Greek word holos, which means whole. So what is a holistic approach? Where basically we understand the body connection. Our colleagues at King's colleagues do a big research regarding that. We use biocompatible materials, bioceramics, non-latex GP for example. We focus on irrigation and activation of areas. I'm sorry. And of course, nowadays we follow minimally invasive approaches. Here are some cases that were done recently. Molars, we can see the lateral canals. Here as well. Yes, as I mentioned, I like to do my own composite build-ups. So the core is quite fresh. And yeah, this is the most important step to me, to actually place, I don't know if you can see my sensor, but to place my orthoband, my matrix band, make sure that my build-up is quite secured. And also, before I place the definitive core, that everything is crystal clear, and we have good bonding with dentin and enamel. Yep, here we are. Why to refer? So, to enhance patients' confidence, to reduce complications. Endodontic treatment is quite complex as a treatment. I had a discussion recently with a colleague of mine. They mentioned lower anterior teeth are so easy in terms of the treatment. I said, no, these are the most complicated cases of all, because the teeth are very, very narrow, very small. We need to respect the anatomy. And for almost 40% of the case, we have two canals. So we need to amend our access cavity. No, it's quite challenging, actually. So yeah, we need to manage the complex anatomy safely, which will lead to improved prognosis. When to refer? When we are not certain about the diagnosis. When, for example, the accessibility testing is not reliable, we don't have the same results every time. When we suspect non-pathogenic pain, when the anatomy is quite complex, so we have good curvature, dense denta, C-shaped molars. When we have retreatment cases, what I explain to my patients is, on retreatment cases, we might find surprises that sometimes we might not even be able to pick them up on the CBCT as well. So we can have ledges, perforations, blockages, all these things. And trauma CBCT is very, very important, so we can appreciate if there are any root fractures, alveolar bone fractures. Vital pop therapies, when we have patients who are very anxious and stressed and they require sedation, we offer sedation here as well. And when you need further help on CBCT interpretation. And you might say, okay, I now have a case, but it's an emergency, the patient is in pain. I still want to refer the case, what should I do? So first things first, we need to make sure that we have a diagnosis. So based on the diagnosis, there is a treatment plan. So when we have irreversible pulpitis, so ideally we want to access the tooth. I know that may be quite difficult to make the patient numb. So if you have a lower molar, for example, you might need to do ID block, infiltration as well, and interligamental. And when you access the tooth as well, interpulpal injections. The moment you access the tooth, the pressure will be released. And you can place corticosteroid dressing, for example, a leather mix, and the patient will start feeling better. Of course, on irreversible uveitis and symptomatic apical periodontitis, we avoid antibiotics. No, we don't avoid. It's a no-no, basically. They will not help. That's why. So yes, symptomatic apical periodontitis. Similarly, we need to access the tooth, and the moment we access the tooth, we can place calcium hydroxide, and we can provide NSAIDs. Acute apical abscess, we need to do incision and drainage. You can access the tooth as well and place calcium hydroxide. And if you suspect systemic involvement, you might want to opt for antibiotics prescription. These are some elements that ideally I would prefer to be included in the referral. This will help me understand the history of the patient's complaint, why this case has been referred to us, if any treatment has been provided, any radiographic record, and if you have already agreed on a long restorative plan. If you had already carried out the restorability assessment for us, that's fantastic. And you can include even photos, which might be helpful as well. So you can scan the QR code. This is how to refer a patient to us. You can add all your details and patient's details. And this is a QR code of my social media, my email address. Please don't hesitate. You can directly contact me if you have any questions. And yes, there is life beyond Apex. So in my free time, I enjoy dancing, yoga, Pilates, sauna, and cycling and traveling. Thank you very much. I hope to meet you all soon in person. Have a lovely rest of your evening. Take care. Bye-bye.